Coronavirus Facts, Not Fear is presented by Hawaii Pacific Health. Stay healthier. Learn more about how to prevent the spread of respiratory illnesses like COVID-19 at hawaiipacifichealth.org/coronavirus.
Aloha and thank you for joining us for this special report on COVID-19, the coronavirus outbreak. At KHON2, we're dedicated to bringing you accurate facts, separating rumor from reality, and keeping you and your family safe. The experts on tonight's panel are uniquely positioned to give you the right information, ease unnecessary worries, and help you prepare for realistic risks, prevention methods, and the latest in treatment and recovery now that the virus has struck here in Hawaii. Lieutenant Governor Josh Green is the state of Hawaii's COVID-19 coordinator. As a physician himself, he understands the medical, governmental, and private sector roles in gearing up against this pandemic.
Thank you.
Dr. James Ireland is well versed in facility capacity and emergency first responder readiness. He serves as the State Department of Transportation's Aircraft Rescue and Firefighting Medical Director.
Good evening.
And former Honolulu Mayor Mufi Hannemann is the president and CEO of the Hawaii Lodging and Tourism Association, seeing firsthand how the travel and business sectors are dealing with preparation and prevention and coping with the nationwide economic impact. And Dr. Rupi Gohil is an internal medicine physician and a frequent on-air personality here at KHON2 and an expert who brings the perspective of a clinician and what to expect when you visit your family doctor with any COVID concerns. Thank you. We begin with a focus here on the early cases in the state of Hawaii. The first, an Oahu man who traveled on the Grand Princess cruise ship, felt sick when he got back to Hawaii, now being treated at home isolation. The second, an elderly Oahu man who flew home sick from Washington State, considered a location of U.S. outbreak, and tested positive Sunday. 15 others have tested negative so far. Our first positive cases are two ends of a spectrum we're seeing worldwide: mild, manageable in-home recovery versus severe, life-threatening situations for our kupuna. Dr. Green, is our state so far a microcosm of the global illness pattern, age-wise or symptom-wise?
Great question. Every different area is a little different. There was an explosion, as we know, in the Hubei province before anyone could even get their arms wrapped around it. Many thousands of cases. Obviously, another explosion of the disease in South Korea and Italy and Iran. We have been lucky so far to have very few cases, very good work from the Department of Health in many areas to prevent spread. But we are now becoming kind of the similar poster child for other states across America where a couple cases pop up. We have not had community spread yet, which is very good for us. We're keeping our fingers crossed and doing all that we can to prevent that from happening, because once you have community spread, it's very, very difficult to keep it under containment.
Dr. Ireland, these first couple of cases are both travel related. Viewers ask, why hasn't the DOT or airport implemented any scanners or screens for all visitors entering the state? Other cities have scanners at their airport. And another viewer asks, this person was sick while traveling. Why didn't it raise any flags at SeaTac or Honolulu Airport? Can you address what airports or airlines can legally or should be doing to better flag or prevent sick travelers?
Well, I think that's one of the reasons why we were so successful initially. I mean, this has been going on in China for 3 months now, in blocking it in Hawaii, because we do have international rules for international travelers. They come through CBP, Customs and Border Protection, have to go through the CDC, and there's a screening process in place at Honolulu Airport. And it was previously there for avian influenza, which we've never seen a case here. But it was very easy to shift gears for coronavirus, and now there's screening and potentially swabbing for that at the airport. So the international, and the other thing too is international carriers, meaning the airlines, legally have to report any ill passengers prior to the plane landing, so it can be met by medical personnel in the CDC. So we have a good handle, I think, on international travelers. But as you know, now that this is in the U.S. mainland, the rules are different for domestic travelers. And I think that's something that as a state we need to look at is, for instance, planes coming from Washington State, what we can do to ensure patients are healthy and well coming in from the mainland. Now, we also know that there is an asymptomatic period with this COVID-19 where people show no symptoms, and other than exposure, we would not have any idea that they were infected until the point when they had a fever or felt ill.
That's true. Now, in both cases, these patients self-sought medical attention that eventually led to testing. Meanwhile, Department of Health still has not tested all of its dozens and dozens of people who are self-monitoring due to travel connections or patterns that raised red flags. Nor have there been any more reported tests of people who came into proximity with Hawaii's first known cases. And doctors since late February have had to ask permission from the Department of Health before even collecting samples or writing up a person under investigation report. Dr. Green, why is the PUI classification and testing still being so restricted by the Department of Health when they have the capacity to test 35 people a day?
I think the Department of Health has been concerned that if we do really broad testing, that they'll be overrun and we'll run out of tests. But I've given very strong advice to all of the principals. I think we do need to exhaust all of our tests weekly, because right now people want to know in the community, the physicians that are contacting me, they want to be sure that every case they possibly could pick up is picked up. We have to leave a little buffer zone, of course, for cases like we're talking about today, for people in the intensive care unit. Also, there's good news on the near horizon, which is that private labs will be able to test in the very near future. That will completely unhandcuff the entire medical community. We should still be smart about it. We should still order the test appropriately. We shouldn't test people with absolutely no risk or concerns or symptoms. But I do feel strongly, and I think the rest of the country feels this way, that we have to test a lot more. I can't tell you in even as strong terms as I've been expressing it. We have to be testing more, because we also have to do a couple things. We have to make sure our physicians feel confident that anytime they, in their clinical opinion, feel someone should be tested, that's being respected. And second, people in the hospital, while they're caring for a patient who I understand just turned negative, there were people on pins and needles for several days using a ton of PPE, personal protective equipment, and they didn't feel that they could stand down, that was not going to be a positive case. So there's lots of reasons to do testing, and it's not just because we as parents worry maybe we've got it and we spread it to our kids, or our kapuna even, God forbid. It's because we must have confidence that we have a full picture of what's on the ground.
Thank you. And that leads to Dr. Gohil. How are doctors on the front line dealing with this very slow to test or high threshold to test, and balancing it with their patients and the public's right and need to know faster and get response?
Well, as the situation's evolved, we've obviously seen the changes occurring. Initially, all the testing was done through the CDC, then through the Department of Health, and as the Lieutenant Governor just explained, we will have testing through local labs very soon. So that will be very helpful for us to be able to identify cases, which is of utmost importance. Physicians in the community are using protocols that are driven by hospitals and healthcare systems that have been put in place to help us identify high-risk patients and make sure that the appropriate testing is being done.
And do you feel you are empowered to push for one if you absolutely feel it's important?
Yes, and I feel that this is obviously improving, and in the upcoming days we'll have a much better grasp on how many cases and how much more testing we can do.
Thank you. Mr. Hanneman, how is the travel industry dealing with this gap between knowing that these patients have flown with other locals, with other visitors? They then went off into taxis and Ubers and hotel rooms and B&Bs and the like. How does the visitor industry professional deal with the fact that there might be a few more contacts out there on the loose?
Well, we've been working very hard, first of all, in taking care of what we're responsible for. And that's everything within the hotel, everything within the businesses and the like. And can't say enough about the wonderful cooperation we've received from the state, with Lieutenant Governor Green, State Department of Health, Governor Ige, to ensure that whoever is checking into the hotel or our hardworking employees can feel that they're going to be working in a safe environment. Now, things that are happening externally, obviously, are of concern to ours, so that's why we want to continue this close dialogue and communication that we have with our health professionals, because at the end of the day, we still want to say that you can come and visit Hawaii. We still want to keep as many people employed. You know, we're the largest private employer in the state, nearly 220,000 people. We're responsible for $17 billion we pump into the economy. And the last thing that we want to do is see our own workers or the industry start to collapse and therefore negate travel altogether. At the end of the day, we still feel we're a great place to come, and safe and healthy for people to come and visit.
Thank you, sir.
I think one thing I just want to tail onto that and add is we are not seeing Uber drivers get infected. We are not seeing airline pilots get infected. We are not seeing people in retail stores that waited on a customer getting infected. This seems to be, and I'm basing this on medical reports from China and what we're seeing a little bit from the mainland, we're seeing this as a condition that close personal contacts, and really unfortunately, like from China, it was healthcare workers, unfortunately, and I don't know what type of protective equipment they had there. Maybe it wasn't satisfactory, and unfortunately family members. So those are the big groups we've seen so far, but as far as, you know, a big gas cloud going over a neighborhood and worrying about all these houses, we don't have to worry about that. This is close personal contact.
A very important clarification.
Like me sitting right next to you. Infection could happen, right? If I had a runny nose, if I was coughing, if I didn't have a mask on, this would be the kind of thing we worry about. So all these other fields, they're pretty calm and safe, and it's best practices, which is why we keep emphasizing this. If you're sick, don't go to work. If you're sick, don't go to school. If you're sick, wear that mask and cover it up.
Excellent. Moving on now to how COVID-19 is spread, its symptoms, and prevention that works. Dr. Gohil, what are the symptoms of COVID-19, and how can you best know it's not just the flu?
So the symptoms have a lot of overlap with the flu, and it's tough for a patient themselves to tell whether they've got COVID-19 or the flu. The symptoms tend to be cough, fever, fatigue, shortness of breath, again, things that are very similar to the flu. Now, as far as the severity of symptoms, they can range from a very mild illness. In fact, somebody might just think they have a mild cold to very severe symptoms. Now, about 80% of people end up with very mild symptoms, and those can even be managed at home, whereas about 14% end up with a more serious illness, maybe potentially hospitalized with a pneumonia, and about 6% end up in a much more serious condition where they could end up on a ventilator or in an ICU type setting.
And flu can be tested very quickly in a doctor's office.
Yes, and so the method to differentiate would obviously be testing to try to differentiate. Now, if someone's had the flu shot, that can help prevent the flu, and it can obviously help decrease the symptoms of the flu, so that would be an important piece here. But to actually differentiate between the two, getting tested would be the method.
The majority of our viewer questions were about the virus on surfaces. How long does coronavirus COVID-19 survive on surfaces, and can readily available disinfectants kill it? Dr. Ireland, can you address that one?
Well, because this is a new virus, coronavirus is not new. There's lots of coronaviruses, including the common cold, also SARS and MERS, but this COVID-19 is new, and so we're learning about it, and as the infections spread and progress, especially in Asia, we're learning more about, you know, exactly how people get infected. To answer your question, we don't know, but it seems like it's hours to possibly days, and it also appears that common household cleaners can kill this. Bleach, alcohol solutions, and the CDC has a wonderful page on this, which I emailed you, so you can link that somewhere on your website, but very clear on how to disinfect, and there's also guidelines for businesses.
Excellent, so carry around your own things. And Mr. Hanna, I'm going to ask you in particular, what are hotels doing differently to clean rooms, surfaces in between guest stays, increase precautions with food service, buffets?
Well, that's always been our main objective from the very beginning. Even before we had these cases that are reported here. We're doubling up everything that we've done in the past, and I think it speaks not just for the hotels, airlines are doing the same. You know, I kind of feel like it's when in doubt, clean it out, because we still don't know, it's still very early. But the sanitizers, going back and all the common places, common areas are also being cleaned 2 or 3 times a day, and that leads us to a strong level of confidence that our workers know that, once again, it's not just to protect the visitors that are there, but people in the workplace. And I think that's very important. And we're going to continue to do that because we feel that, once again, until there's another industry out there that's going to provide the thousands of jobs that we're going to provide, it's important to keep as many people employed so we don't have to go down that path and start looking at layoffs and the like.
That's true. Dr. Green, please talk about the risks of spread when people are asymptomatic versus visibly sick. A viewer asks, please provide a definitive answer. Can an asymptomatic person carry and spread the virus?
Very rarely. Very, very rarely. The conventional wisdom on things like flu and coronavirus are, you shed the virus most, meaning you have the virus coming off of you the most when you're having your fever, when you're having your symptoms of coughing, when you're having your runny nose, when you're feeling the worst. Now, having said that, usually on a day either side, you may still be somewhat infectious. And that's what makes people nervous, right? Because they see me looking totally healthy, and maybe it's tomorrow that my symptoms will begin. But you will be at highest risk when people are having those active symptoms, mostly because this is a droplet-borne infection, meaning the droplets from our nose and from our sneezing and coughing, that's what goes out to about 6 feet and drops. And if it lands on a person that we're sitting next to, that's the highest risk. So it's really those symptoms, and that's where people should be most focused, but that doesn't mean we don't take total precaution. We still are very careful if we've been in contact with someone who's had coronavirus, or the flu for that matter, and we're even a little extra careful right now around our kapuna under any circumstances because they're more at risk.
We're going to address seniors in particular toward the end of the show. Dr. Gohil, if you get COVID-19, are you likely to have then built up antibodies for immunity against the same strain in the future? A viewer asks, is it possible to become reinfected with COVID-19? Isn't the body's immune system creating antibodies that are specific to fight off COVID-19?
So I think it's too early to tell for sure. As the situation evolves, we'll probably have a much better idea. But as we've mentioned, this is a novel virus. It's a new virus. We don't know much about it. We do know about coronavirus in general, knowing that this is a group of viruses. However, how this one is going to behave, it's really hard to tell. It's likely that you will develop antibodies, as anyone would to an infection. However, whether or not a reinfection is possible is unknown at this time.
Thank you.
That's a great question, though. And we are hearing some reports that people possibly have been reinfected. But again, 1, 2 reports, not maybe even knowing what the confirmed diagnosis was initially, because this is from Asia, agree that it's still too early to tell. But I have heard those reports as well. It's a good question from the viewer.
It is one to watch. Moving on about gathering, public spaces, business economic impact. The economic impact of COVID-19 is already hitting Hawaii, even before the virus had hit here starting last week. Many businesses and schools are taking their own precautions, but Dr. Green, how would a state-mandated shutdown of workplaces or schools be handled? How much advance notice would the community be given, and how long would a mandatory shutdown last?
Well, those are pretty broad questions. I've spoken at great length with our superintendent of schools. They do not intend to close the schools unless it's absolutely necessary. If we're not seeing community spread, they definitely don't want to do it because they don't want to send sick children home where they could be in contact with other sick people. And we also have school nurses and so on. Same thing for businesses. We will ask people to work from home if they're sick. If you are sick, it's better not to go to work as an individual. But to do it carte blanche and to shut down businesses, sometimes where you have to be there in person, would be devastating to our economy. We have to put health first, no matter what we do. It's why we are asking the tougher questions about cruise ships, why we're asking the tougher questions about our hotel industry. But that's been very well described so that we're doing as many safe things as Mufi described. We want to make sure that people are equipped to do best practices, just like the hotels, just like in our hospitals. These are the places that we can't afford to shut down. Take the hospitals, for example. We want to make sure our hospital personnel are very well protected against any possible exposure so that they don't have to take 14 days away at home. That could devastate our capacity to care for everybody, including our tourists. We might then utilize them for telehealth, interestingly, but I will tell you this. If we do the right things and we keep ourselves protected and people take the right precautions to not go to work when they themselves are sick, then we won't see spread and we won't get there.
Excellent. A viewer asks, how do I evaluate if I should go to a large gathering? Dr. Ireland, could you advise?
I think that's an individual decision. You know, personally, I've been talking with my own family about this, and I personally wouldn't fear myself going to a large gathering. You know, there's these kind of hybrid handshakes people are doing now with the elbows and the air high fives, and you know, maybe the traditional hugs and shakes and greetings might change a little bit. I'm taking hand sanitizer in my pocket so I can wash my hands before I eat or, you know, after I shake people's hands. But to me personally, I'm not worried about large gatherings. You know, I'm not going to go to one in Seattle next week. You know, I'm not going to go to China. But here in Hawaii, I have no fear at all going anywhere.
Excellent.
I'd like to jump on that. I think what it really comes down to is common sense and good judgment. We know that seniors are especially vulnerable in large gatherings alike. So I want to tip my hat off to University of Hawaii, not just because I'm a sports fan, but having that big BYU University of Hawaii volleyball game nearly 10,000 people came to the Stan Sheriff Arena. And I think that's important in these down economic times, or not down economic times, when we have sort of a crisis in our community, in this particular case, a health crisis, that we continue to do things that will make people feel good. And besides, we're still saying that Hawaii is still open for business all the way around. So if we can lead by example in that regard, using common sense, good judgment, I think then we'll make the right decisions.
The tiniest little addition, and totally agree. If you are sick, though, obviously, if you have a runny nose or fever or short of breath, you should not go. That's the most basic thing, so that the healthy people at the events are going to be okay, and you'll be healthy from your flu, which is probably what it is, in a week. Then you can go to the next game.
And I'm going to tack on as well. I think for our at-risk community, our elderly or immunosuppressed, just taking those extra precautions, making sure the basic hygienic precautions are taken. If there is concern that it's a small, not well-ventilated area, maybe consider avoiding. But otherwise, just making sure that you're taking those basic hygienic precautions.
Excellent. Our next fact check before the next segment. While the state recommends you stock up on 14 days of emergency supplies, as they recommend year-round in our natural disaster-prone state, this virus will not affect things like our fresh drinking water, our power supply, nor is it expected to shut down cargo ports. In this case, the supplies really are meant to prevent you from having to go to the store if you're quarantined. Moving on to our
We're ready
next.
for hurricane season 3 months early.
And you'll be ready for her. See, there's a perk to being ready early. And the water will still run, bottled water, you know, nice to have, but should you not have it, your faucets will run. Moving on to more about travel and cruises in particular. A viewer asks, my question is concerning bus drivers that transported cruise passengers from Nowili Harbor for February 26th. This viewer feeling like she didn't see cleaning in the Kauai community. Lieutenant Governor, you said Friday afternoon the cruise industry should take a 60-day timeout. You've asked the White House for even more protections. Tell us what you're doing about cruise ships in particular and why.
Well, the conversation's going on now. At the highest levels, mayors and governors and the president's team are all talking about it and going to make final determinations. Just today, the CDC brought out some additional recommendations for cruise travel, and that was mostly focused on individuals who are older or with immune compromise or chronic disease. They're discouraging from travel. And then on the younger side, where people are much more able to deal with the coronavirus, they don't see it as significantly a problem. I think we're just going to have to assess this very carefully with the industry so that we know if we do have cruise ships here. I think there's some good recommendations to check people as they come off of cruise ships. Jim told me that we were talking about that earlier with some of the leadership. Check people's temperatures. These are the kind of things which we will have to assess day to day, because the big picture is the long game for tourism, the long game for our health, the ability to keep the most vulnerable people from getting sick. That's just where I was coming from, just from a health perspective, not necessarily from a tourism perspective.
Thank you. And Dr. Island, there's been a lot of talk about what's being done at Honolulu's airport, but what's being done or still needs to be done at airports and cruise ports of entry on the neighbor islands as well to catch and quarantine potential carriers?
Well, again, because not many international carriers went to neighbor island airports, that focus obviously was in Honolulu, and the program was already set up there, which is a federal program under the CDC's leadership. But Lieutenant Governor and others at the state have been discussing how we could also augment the neighbor island airports, because again, people coming from the mainland now could carry infection, Washington State and other places, and so that really needs to be looked at and is being looked at.
Thank you. Dr. Rapal, a viewer asks, a doctor told me air filters on airplanes are industrial strength filters and do a very good job of filtering bacteria and germs. Very little ends up being redistributed. Is this true? How safe is air on flying on an airplane? And what can the flying public do in their little zone of proximity on those cramped planes?
That's a great question. I don't have the answer to airplane air filters. However, the highest risk are folks that are sitting within a 6-foot radius. And so if someone is coughing, sneezing, in general, we've talked about making sure that they're wearing a mask when they're traveling, and trying to take the precautions of coughing into the elbow and whatnot. So if someone was to have symptoms, they should be taking those precautions. If someone is exposed to that, and there is a concern, then they need to speak with their physician when they return from travel. Now, as far as the environment around themselves when they're traveling, those disinfectants that Dr. Ireland was speaking about earlier that are listed on the CDC website as well as the EPA.gov website, those list of disinfectants could be used for the surrounding area, and that does tend to appear to kill the virus.
Take a Lysol wipe with you in a bag. Great.
I can give you kind of some breaking news. We did regarding this person that just came from Seattle and flew here. We're taking the extra precaution of going further out to go an extra row so we can get into that 6 feet area. And I think that extra precaution, so 2 rows up, 2 rows back, is what we're doing and applying to that gentleman who now we know was positive. And I was on a plane yesterday with a woman who cleaned the entire seat. I mean, that is the cleanest seat in the history of mankind right now. And so I felt quite comfortable, and she was feeling very uncomfortable. And we were able to talk about the risk to us as citizens. So people are so aware it's a good thing that they're cleaning things up and they are taking these precautions.
Excellent.
One of the things, just to interrupt again, one of the things I'm just really interested in is we are doing so much more cleaning now. I mean, there's already cleaning, but we're doing so much more now and so much more aware that I'm interested to see as the months go on if we see less of the flu, colds, and just other germs that we kind of just pick up all the time and don't really think about.
Yes, we will. We're living in a cleaner community. Moving on to our segment about seniors and those most at risk in particular. Many viewers asked, who is most at risk? One says, I'm a senior. Untested young people with mild symptoms will be my fear of who's spreading the virus to me. Dr. Gohil, how would you advise seniors with these concerns?
So the seniors that are at the highest risk are those with an underlying medical condition. So when someone asks me, well, what are these conditions that you're talking about? We're talking about heart disease, lung disease, chronic kidney disease, diabetes. For the most part, folks who are on medications that can cause immunosuppression, so someone who's on chemotherapy or on steroids for a rheumatological problem, those are the folks that are at the highest risk at this time. Now, those folks should be taking the precautions we've discussed, but also preparing for potential for self-quarantine. The concern is that if they get exposed or there is an exposure, whether it's within their family or someone that they're in close contact with, they should be prepared with their medications for at least a 30-day supply. They want to also make sure that they have a space in their home that they can self-quarantine, as well as food and any supplies that they might need.
Thank you. Viewers point out Hawaii can have more mild flu seasons than many colder, drier climates. Dr. Green, our emergency rooms and doctor's offices, seeing this same pattern this flu season. Is this pattern also expected to be the same perhaps for COVID-19? Would COVID-19 dwindle as the flu season does?
Well, we're seeing a lot of flu this year, is all I can say. I'm personally seeing a lot of flu, and I'm on call this weekend again. So we're testing for flu, and a lot of people are testing positive. I can tell you psychologically, every person I saw thought that they had COVID-19, and none of them did. So that's a relief. They all had the flu.
Only time people are happy to have the flu,
Yeah,
to be honest.
Yes,
But
it's made the flu very popular.
But Jim's probably right. We're because we're taking more precautions, because a lot more people are putting masks on when they are sick, they're going to spread it less. When we're washing down our chairs at the airport in the seats, we're going to spread a little less other bacteria, other viruses. So hopefully it'll curtail. But people should remember there are going to be globally 500 million cases, very likely, of the flu. In the United States, there are probably going to be 35 to 40 million cases of the flu. And here we are sitting at 110,000 cases total globally that we know of COVID-19. And the flu can be quite lethal too. So these are things for people to weigh. Of course, we want no one to get COVID-19 in Hawaii, and we've had 2 cases. But the flu is going to take more of our citizens, I'm sad to report. And so that's going to be something that we weigh going forward.
Thank you.
Every crisis presents an opportunity.
Yes.
So the opportunity here should be for seniors that may have always wanted to go cruising, if you will, or for people that still want to travel with spring vacation come up, do a little stay vacation.
Great
Stay
idea.
right here in the
Yep.
state of Hawaii, and let's help each other out. Because that's what it comes down to. We're all in this together.
And we'll have the healthcare capacity to take care of you if you do fall ill, but Mufi's point is a perfect one.
A nice time to stay home for spring break.
There you
A
go.
great idea. Thank you so much to Lieutenant Governor Josh Green, Dr. Rupal Gohil, Dr. James Ireland, and Mufi Hanneman.
I'm not a doctor.
No, we'll give you the honorary. We'll give you an honorary doctorate today. And thank you also to our viewers for your attention, your concerns, and your great questions. We hope Coronavirus Facts, Not Fear has helped you build a better understanding of COVID-19 and how you can keep yourself and your family safe. Good night and aloha.
Coronavirus Facts, Not Fear was presented by Hawaii Pacific Health. Stay healthier. Learn more about how to prevent the spread of respiratory illnesses like COVID-19 at hawaiipacifichealth.org/coronavirus.